Hey, I'm Shiva, physiotherapist with Revive Spine and Sport Physiotherapy and Chiropractic Clinic. Today we're going to talk about exercise for knee injuries and knee pain. This is very commonly we see in our practice. So we're going to talk about exercise progression, progressive loading for knee pain. First, we're going to talk exercises in lying position where we have very minimal loading for the knee. The first exercise focuses on improving the knee joint mobility. We call it as heel slide exercise. By Sudarshan, some model today, thank you. He's going to demonstrate some exercise, heel slide exercise, which helps to improve the knee joint range of motion. It's very important because we need to reduce the stiffness around the joint so that we don't get into stiffness or contractures later. So this is one of the exercises where you gently drag your heel towards your buttock and push it back. Do it like 10 to 20 reps, 2 to 3 times a day. The next exercise, we're going to focus on the thigh muscle. So you can add a towel roll or a pillow at home. Here I'm using a foam roller. Goes under the knee. So I'm going to ask Sudarshan to press his knee onto the foam roller, tightening this muscle. I'm going to relax, I'm going to relax this, tighten this. You can add a variation where you're going to press, you're going to gently lift this leg and hold it. And as you hold the muscle contraction for around 5 seconds and slowly relax. So now that we have worked our quadriceps muscle, we're going to focus on the muscles at the back of the thigh, hamstrings, whereby I'm going to move the roller a bit down. I'm going to push on the leg and engage the muscles at the back of the thigh. As you feel the contraction, hold it for around 5 seconds, 10 to 20 reps, a couple of times a day. Final exercise, we're going to engage the muscles, the inner part of the thigh. For this, I want Sudarshan to roll this leg out like that, toes pointing. Then keep the leg straight and just lift the leg off the couch. So this is going to engage the muscles in the inner aspect of the thigh. To make it more difficult, you can add an ankle weight, strap weight here. You're going to tie this weight around the ankle here. You're going to feel more resistance. That will engage more muscle activity. So these are the 4 exercises in lying. Now we're going to progress to sitting. Can I get you to sit, Sudarshan? So in sitting, first and foremost, you don't need any equipment. You're going to sit straight and kick your leg out. Feel the contraction in front of thigh. Hold the contraction for around 5 seconds and slowly take it back. Do it for 10 to 20 reps, 2 to 3 times a day. To make it more difficult, we could add some elastic weights or ankle weights like we discussed before. So take the ankle weight, put it here, tie it, and slowly bring it up. Feel the tension in the muscle, hold the contraction, and slowly take it back. I want to also include a Thera loop here. So first we're going to focus on the front quadriceps muscle. So the tension is kept from the other leg. So this leg kind of works against the resistance. Keep going. Now you're going to work the hamstrings muscle where you keep the leg straight. You need some, yeah. So here the action is he's going to bend the knee and pull it towards him, engaging the back of the thigh. So these are some of the exercises that you can do it in sitting. Now we're going to progress to standing. Stand up, please. So if you're in pain and if you can only load partially, first put most of your weight onto the good side, please, and gently load onto the injured side to the point where you feel a hurt. Just back off a little bit, then come back. So this is you're starting to load, coming back. Eventually, then I want you to put your leg front, whereby you're going to engage some extension and add some strength to go forward to the point, then slowly come back. Come back. And this, we can do it in multiple directions. Imagine there's a clock in front of you. So you're going to progress from 12, 1, 2, towards here, vice versa, you can go back. So this is adding loading in multiple angles and engaging different muscle groups. Okay, so now you're able to stand, you're able to load in different patterns and different angles. Now we're going to really work on loading and strengthening your muscle in full force. We're going to start off with some squats. You can have your hands for your comfort, you can have it at the back or on the front. You're going to hold it, gently stick your buttock back, and go down. Some people tend to bend the trunk forward, just try to avoid it and try to keep it straight and stick your butt back in. So these are regular squats. You can add some weights by holding onto some dumbbells if you need, and do it like 10 to 20 reps. That you can feel a discomfort but not pain. Next one is forward lunge. You want to put your leg forward. Slowly lift up your back leg. Switch legs if you want. We're going to add some lateral lunges. We're going to put your legs to the side. Okay, so these are some of the loading exercises in standing. Thanks for watching the video.